most about sugar. It's linked to obesity, diabetes, heart disease, and cancer. But today, we are looking at a sugar substitute. It is called xylitol. Local dentist Dr. Partha Barua joins me. Thanks for coming in.
Thank you for inviting me.
First of all, what is xylitol? How is it produced?
So xylitol is a 5-carbon sugar alcohol.
Okay.
So it is of course it is trademark, and they have secrets about it, right? They
about how it's produced.
Yes.
Okay.
But it has been used for last 1 decade in various forms, like toothpaste, your mouthwashes, and everything. In Finland, it is used as a preventive measure for school kids to prevent cavities.
To prevent cavities?
Yes, in Finland.
Even though it's a sugar?
Yes, even though it's a sugar. How it works is it prevents the formation of biofilm. So when bacterial sugars, like bacteria acts on sugar, what it does, it forms matrices. We call polysaccharide matrices.
Okay.
And those matrices harbor a lot of bacteria. What the xylitol does in that is it doesn't allow the matrix to form.
Okay.
So thereby it prevents the plaque formation, so it helps in preventing cavities and maintaining oral health.
Okay, so it's a sugar that you can use in toothpaste.
Yes.
Can you use it, for example, in a cup of tea or a coffee?
Yes, I have people like doctors or dentists whom I work with, or who are my mentors and who are my gurus. They are using it quite a bit in States. So in States, it is used more right now than in Canada.
Okay.
But it has been in use in Europe and other countries for last 10 years in different forms. So there are gums that we can chew that will decrease the plaque formation, because what it does, it disperses. So the studies have shown, like clinical studies have shown, that by acting on preventing formation of the polysaccharides or the film, biofilm, like if you brush and after 1 hour, you just use your nail and move over your teeth, you'll see a white substance.
Sure.
That is called biofilm.
Okay.
So like that, there's a lot of biofilm forming in our mouth, right? So that biofilm later on forms your plaque and then tartar.
It just builds up over weeks and months, et cetera, et cetera.
Right.
Okay, you've got some products that use xylitol. Tell us what they do.
One is called Clear. So this is a product used basically for nasal spray, as a nasal spray. What we use that for is to look at different kinds of dystrophies or something, because I do practice of TMJ, which is temporomandibular disorder with craniofacial pain like headaches.
It's one of those jaw conditions.
Jaw condition will be, you'll have clicking, you'll have grating sounds, you'll have difficulty opening mouth, you'll have associated muscle pain along with that, then people will find difficulty in swallowing and stuff like that.
Okay.
And also it will come with headaches, it will come with neck pain, and other things.
And a nasal spray prevents that sort of thing?
No, nasal spray helps in increasing the breathing. So when we have difficulty in breathing through our nose or partial blockage is there, what we do, we mouth breathe.
Right.
So automatically our mouth opens up to breathe.
Right.
And as we start breathing through our mouth, we start hunching.
Yeah.
And as the mouth gets dried up, so what we'll do, we will swallow. And as we swallow, so this muscle is pushing, clenching is happening. So that causes starting muscle aches, and in the long run, chronic cases, then they start having joint pain.
Okay, and maybe the biggest impact is for couples who have one of them, who snores at night.
Yes.
How does this address that issue?
So what it does, if we use the Clear, which has 5% xylitol in it, what it does, it opens up the nasal pathway.
Okay.
In the long run. How it does that? By shrinking the turbinates by soft tissue. So generally, if it is a severe case, obviously, I'm referring to an ENT or ear, nose, throat doctor. Yeah. But if it's just soft tissue, mostly because of diet, what we eat. So if we are eating inflammatory food like your sugar, refined carbs, then what happens? It causes inflammation in our body, and thereby it partially causes swelling. Yeah. And as the swelling increases, then our pathway to the airway decreases, and then mouth breathing starts. Yeah. And then mouth breathing causes dry mouth. So everything is related with the nasal breathing. Yeah. So our goal is to release the nasal pathway blockage by using different products, over-the-counter products, and they don't have steroids or they don't have anything.
Well, and that's the key thing, is that these products are available in any pharmacy over-the-counter.
Over-the-counter, not in Canada yet. I'm trying, but not yet.
Okay.
We are trying to get it to Canada. It is mostly available in States or in Amazon right now. And but the pets shouldn't be getting access to this because it will cause severe issues in that.
Okay.
So when you use this product, keep away from pets, because pets always like to, dogs, they like to go to.
Of course.
Right
to know. Okay, thanks for coming in.
Thank you.
And for more information, you can visit Smile32Dentistry.com, or you can check them out on Facebook or Twitter.